Early clinical exposure of central nervous system or the neurological disorder. So whenever you get a pain in your life, just think about the full form of the pain. So pain का मतलब क्या है? Positive attitude in negative situation. So this one are the basic function when you get a pain. So you should remember mentally you can well-being than your doctor's medicine. So if there is a your willpower is very strong, then you can recover fast along with this medical. So today's topic is neurological disorder. So what is the neurological disorder and why there is a development of this neurological disorder? So central nervous system initiated by sensory stimuli. So this one are the function of the central nervous system. So the relationship of the afferent sensory stimuli to the memory bank and correlation and the coordinating enter the common efferent pathway. So here you can see the sensory stimuli through this afferent impulse. So memory, there is a correlation and the coordination, and there is a efferent vessel, efferent nerve fibers. So it act on the either muscles, gland or any part of this body. So central nervous system का जो main relationship है of the afferent sensory stimuli to the memory bank, and there is it correlation and the coordinating center and the common efferent pathway. So this one are the basic mechanism of the nervous system. So it get a reception, integrate, initiate, assimilation and the higher function. So subdivision of the central nervous system, it maintain the internal environment and reach and react to the change in the external environment. So first you can see this subdivision of the central nervous system. So central nervous system are the control, regulate and the other system of the body or the master of the master system of the body. So name is given this master system because it control, regulate other system of the body. So master system of the body name is given this central nervous system. So any congenital disorder, there may be name is given this central nervous system along with this developmental defect, name is given this congenital defect or the congenital disorder. Example anencephaly, hydrocephalus, spina bifida. And traumatic disorder, either there may be concussion or the contusion, diffuse brain damage, injury to spinal cord, inflammatory and meningitis. So this one are the traumatic. So meningitis also including in this inflammation or the infection, either after the death or there may be some bacterial or the viral infection. So these are the traumatic manifestation of the central nervous system. Now it may be neoplastic, there may be malignant disorder within this brain tissue, name is given this neoplastic. Then degenerative changes occur in the central nervous system, either there may be Parkinsonism, Alzheimer's disease, third one there is a epilepsy, then migraine, cerebral palsy. So this one are the disorder including in nervous system. Major defect occur in the vascular disorder. So vascular disorder including in this extradural hematoma and the subdural hematoma, subarachnoid hemorrhage, intracerebral hemorrhage, and there is a thrombosis. So this one are the vascular disorder, either there may be extradural hematoma after the injury of, or rupture of this any blood vessels, or there may be some injury external and internal. Subdural hematoma, thrombosis and embolism. This one are the disorder along with this blood vessel of this brain. Now function. So what is the functional disorder? So in case of this functional disorder, there is a schizophrenia, mood disorder, then mental retardation, peripheral nervous system, including the neuralgia, neuropathies. So this one are the subdivision of the central nervous system. Majorly divided into the central nervous system, peripheral nervous system, and autonomic nervous system. Further division of the central nervous system in brain and spinal cord. Then spinal cord, already you learned about these details, gross anatomy and internal and external structures of the spinal cord and its extents and its function. Then peripheral nerve, including this both spinal nerve and the sensory nerve. So nerves are all, it arises from this spinal cord. From the anterior horn there is a motor root or the ventral root. Posterior horn there is a ventral root or the posterior root, and these fuse together to form a spinal nerve. So peripheral nervous system divide into this spinal and the and cranial nerves, and autonomic nervous system divide into this parasympathetic and sympathetic. Now brain is further divided into this cerebrum, cerebellum and the brain stem. Now brain stem is further divided into this midbrain, pons and medulla oblongata. So this one are the subdivision of the central nervous system. First in brain and spinal cord. So brain is further divided into this cerebrum, cerebellum and the brain stem. Now brain stem is divided into this midbrain, pons and medulla. Now central nervous system including the brain and spinal cord and integration control the center, both internal and external environment. And peripheral nervous system including this peripheral nerve, both cranial nerves and spinal nerve. There is a 12 pair of this cranial nerve and 31 pair of this spinal nerve. So they communicate between the central nervous system and the body. Now peripheral nerve further divide into this sensory division and motor division. Sensory division also name is given this efferent division, and motor division name is given this efferent division. So composed of sensory neurons conduct the signals from the receptor to the CNS. And composed of this motor division, there is a motor neurons conduct the signals from the CNS to effector. And autonomic nervous system and somatic nervous system further divide into this motor division. So it controls the involuntary response, it controls the voluntary movement. And sympathetic division and parasympathetic division further classify into the autonomic nervous system. So sympathetic division are the mobilized by the system and fight or the fight response. In parasympathetic division are the convey the energy, rest and digest the response. So these one are the major central nervous system and peripheral nervous system. So I would like to give you one clinical base case because you become a doctor when there is a suddenly 61-year-old woman collapse in the supermarket and was in a coma when admitted to the emergency department of the hospital. So what you should do? The first diagnosis confirmed by the positional emission tomography, which show an absence of this blood flow through the leg area on the medial surface of the right cerebral hemisphere. So this one are the one case suddenly woman is get collapse in supermarket and she is admitted in the emergency department hospital. So you should know about the blood supply of this brain because the brain is only 2% of this adult body weight and receive 50% of this blood. 750 ml per minute. So neurons have a high demand for the ATP and therefore the oxygen and the glucose. So a constant supply of this blood is critical to the nervous system. So 10-second interruption of this blood flow may cause the loss of consciousness. So see women you can see suddenly she get into the coma. So 1 to 2 minute interruption can cause the significant impairment of the neural function. So either there is a second or the 1 to 2 minute interruption. So there is a significant impairment of this nervous function. So 4 minutes without blood cause irreversible brain damage. So once there is a lack of this blood supply to central nervous system or the blood, there may be lead to the irreversible brain damage. So either there may be cause of this death, so common cause of this death, there may be cardiovascular disease or the stroke. So stroke, it may be due to this thrombosis, embolism or the hemorrhage. There may be three type of this classification of thrombosis, embolism and hemorrhage. So what is the thrombotic stroke? So here you can see this area is deprived of this blood because of this blood clot, thrombopus block flow of this blood in the brain. So you can see this arterial pattern here, there is a presence of this fat or the plaque thrombus. So it may lead to this lack of this blood supply to the brain. So this area are the deprived of this blood. Second are the embolic stroke. In this clinical condition, there is a fatty plaque or the blood clot, either embolism, break away and flow to the brain when it block in an artery. So this may lead to this area of the depression of this blood. then there may be embolic stroke. And there may be area of this bleeding, break in the blood vessels, either in aneurysm in any vessels, it supply the brain. So this clinical condition there may lead to the cerebral hemorrhage. So one are the location of the circles of Willis. You should have a knowledge about the arterial pattern and the blood supply of this brain is very essential, because location of the circus Willis it mainly at the interpendicular fossa at the base of this brain. So this area name is given this interpendicular fossa. Here there is a communication of this arterial pattern of the branches of this internal carotid artery and branches of this basilar artery. Ultimately, it is branches of this fusion of these two vertebral artery. So this one are the location of the circus of Willis. Now formation of the circus of Willis, it is formed by this branches of this internal carotid artery and branches of this basilar artery. So here you can see this arterial pattern, it gives several branches and communicate through this posterior communicating artery with the branches of this basilar artery. And here there is a communication of this arterial pattern to form a circle of Willis. Of this part of pattern of the central nervous system. This clinical condition, there is a 4% aneurysm occur at the posterior cerebral artery, 20% occur at the posterior communicating artery, 34% occur at the branches of this middle cerebral artery, and 40% occur aneurysm at the site of this anterior communicating artery or the anterior cerebral artery. So this clinical symptom, there is a dilatation and the shortening of this lumen of this artery, and there may be rupture. This clinical symptom name is given this hemorrhagic or the hemorrhage occur in the arterial pattern. So commonest short note on the location of the circles of Willis, formation with diagram, functional importance, branches and its distribution and its applied is important. So first, branches of this vertebral artery. So vertebral artery arises from the subclavian artery, first part of the subclavian artery. This one at the first part of the subclavian artery. Then from the C7 to the first cervical vertebra, this part are the second part of this vertebral artery. Within the suboccipital triangle, here it gives the third part of this vertebral artery, and at the brain, base of this brain, within this medulla oblongata, these two vertebral arteries fuse together to form a basilar artery. So here it gives the posterior spinal artery, posterior inferior cerebellar artery. This one are the posterior spinal artery. This one are the both anterior and posterior spinal artery. This one are the anterior spinal artery. Here it gives the posterior inferior cerebellar artery, then anterior spinal artery, spinal branch. Here it gives the spinal cord, and this one are the small spinal branch. Then meningeal branch. Here it gives the meninges of the brain and spinal cord. Then medullary branch. It supply this medulla oblongata. So this one are the major 6 branches of this vertebral artery. Then this vertebral artery, it supply the blood supply of this spinal cord. Mainly it supply by this branches of this anterior spinal artery, branches of this posterior spinal artery and radicular artery. So this one are this anterior radicular artery and posterior radicular artery. So this one is the major blood supply of this spinal cord by the branches of this vertebral artery. Now what is the radicular artery? It arises from the spinal branch of this vertebral artery. Either it may arise from this vertebral artery or the posterior intercostal artery or the lumbar artery or the sacral artery. So this artery name is given the spinal artery. So this one are the radicular artery or the arise from spinal artery. So arteria radicularis magna are the large on the left side artery of the Adam kinesis, right, or the T9 T11 intercostal artery, and it supplied a 2/3 of the spinal cord lumbar enlargement. So this one name is given the largest branch on the left side. This one is the artery of the Adam kinesis. So this one are the supply of this spinal cord. So any depravation of this blood supply of the spinal cord, they may lead to this anterior cord syndrome or the posterior cord syndrome. So complete motor paralysis, here there is a loss of this pain, temperature, sensation, position and vibration, sense and the preserve associated with severe flexion injury. Now vascular lead to the syphilis or the vitamin B deficiency. There may lead to this posterior cord syndrome. So posterior cord syndrome, it may lead to this posterior column damage, vibration and the proprioception loss below the level of this lesion. So here there is a motor loss vibration and the proprioceptive loss, and the pain and temperature. Now, vein of the spinal cord, it divide into the 6 veins surrounding the spinal cord: two medial vein, two anterolateral vein, and two anteromedial vein. So here you can see this diagram. This one are the posterior medial vein, this one are the anteromedial vein, and this one are the anterior radiculomedullary vein, and this one are the posterior radiculomedullary vein. So this one are the median vein, anterolateral and anteromedial vein is the venous drainage of the spinal cord. So radicular vein may be superior viscera, cranial venous sinus, inferior communicate with this internal venous vertebral plexus. An internal vertebral plexus connected to the segmental. Now another branches of this basilar artery. So this one are the basilar artery. Here it gives these branches: anterior inferior cerebral artery. This one are the anterior inferior cerebral artery. Then labyrinth artery, this one are the largest one are the left hand artery innervate the, it supply the ear. Pontine branch, here there is a small 4 to 5 branches, it supply the pons. This one are the pontine artery. These are the superior cerebellar artery. Superior cerebellar artery supply the cerebellum, and this one are the posterior cerebral artery, it supply the cerebrum. So anterior inferior cerebellar artery, it also the branch of this basilar artery and supply the cerebellum. Now cerebellum, it's supplied by the superior cerebellar artery, posterior inferior cerebellar artery, and anterior inferior cerebral artery. So this one are the branches of this internal carotid artery and basilar artery. Now terminal branch of this posterior cerebral artery are the temporal, occipital, and occipital branch. So this one are the temporal and occipital branch. These two are the terminal branch of this posterior cerebral. Now branches of this posterior cerebral artery, here there is a central branch. So here you can see this posterior medial and posterior lateral. This one are the central branch of this posterior cerebral artery. It supplies the posterior half of the cerebrum, and this one are the superior cerebellar artery, supply the cerebellum. Posterior choroidal artery, it supply the lateral and the third ventricle. And cortical branch, this one are the posterior medial and the posterior lateral. This one are the central branches of this brain. It supply the cortical area of this brain. Now cortical branch, here you can see this cortex, both frontal cortex, parietal cortex innervate by the anterior cerebral artery, and the small part uncus it innervate by the anteromedial surface. This one are the middle cerebral artery. This large area, lower and posterior part, it supply the posterior cerebral artery. And on the anterolateral surface, this small area, this supply by the anterior cerebral artery. This small area supplied by the posterior cerebral artery, and largest area on the posterior lateral surface, it's supplied by the middle cerebral artery. So any damage or the occlusion of this posterior cerebral artery, it may lead to this contralateral homonymous hemianopia with macular sparing and visual hallucination associated with this cortex. So this congruent homonymous hemianopia sparing the macula because the occlusion of this posterior cerebral artery supply the interior part of this occipital cortex. Now internal carotid artery here has no branch in the neck. It divide into this at the triangle of this carotid triangle into the external and internal carotid artery. So external carotid artery, it supply this head and neck area, and internal carotid artery, it communicate and enter into this carotid canal and it arterial circles of Willis to supply the brain. So it entered the cranial cavity, joint and basilar artery, which is formed by the union of these two vertebral artery and form the arterial circles of Willis to supply the brain. In addition, it supply the nose, scalp and eye. So this one are the branch of this internal carotid artery. It divide into this cavernous part, cervical portion. This one are the petrous part. This one are the cavernous part. And this one are the cerebral part of this internal carotid artery. Now internal carotid artery, it gives first there is a vertical upward below the skull to enter the carotid canal, forward medially carotid tympanic branch of the middle ear. So this diagram is representative of the 6 right angle bend of the internal carotid artery. First bend here, it entered the internal carotid canal. Then second bend occur at this vertical upward toward the top of this foramen lacerum. Third bend at the forward in this cavernous sinus inferior hypophyseal branch. Fourth one at the vertically upward medial to the anterior clinoid process ophthalmic branch. And fifth one, this one at the backward on the roof of the cavernous sinus superior hypophyseal and the anterior choroidal branch. And sixth one at this upward and slightly backward to the terminal posterior communicating branch. So this one at the carotid bend at the angle of the bend of this internal carotid artery. And here it is divided into this middle cerebral artery, posterior communicating artery and anterior cerebral artery. So this one are the branches of this internal carotid artery. In cervical part there is no branch. In petrous part there is a caroticotympanic branch and pterygoid branch. In cavernous part, two trigeminal ganglions, superior and inferior, hypophyseal and the meningeal branch. And in cerebral, here it gives anterior cerebral artery, middle cerebral artery, and anterior and posterior communicating artery and ophthalmic artery. So these one are the major branches within this intracranial or the cerebral branches of this internal carotid artery. This ophthalmic artery further divided into the central artery of retina. This one are the end artery. Here there is a supratrochlear and the supraorbital branch, long and short posterior ciliary artery, lacrimal and the macular artery, and the anterior ciliary artery. And ophthalmic artery further it gives the anterior ethmoidal artery, posterior ethmoidal artery, dorsal nasal, external nasal, and internal nasal branch. Now long course of prone for the thrombosis. It supplies the lateral ventricle, inferior horn, optic tract, hippocampus, internal capsule. So internal capsule is supplied by these branches of this internal carotid artery. So you can diagnose by the cerebral angiography. Dye is injected either common iliac vein, this one are the terminal branch of this abdominal aorta, or it may be introduced through this basilar vein. This one are the largest vein, superficial vein of this upper limb, and you can dye is injected through this basilar vein or the common iliac vein, and you can do the carotid or the cerebral angiography. So you can easily diagnose by the any occlusion of this arterial supply of this cerebrum. So cerebral artery, it supply mainly anterior cerebral artery, middle cerebral artery and posterior cerebral artery. So this branching pattern either in cortical branch, central branch and choroidal branch. So this one are the major blood supply or the arterial supply of this cerebrum. So here you can see this anterior cerebral artery. It terminates into the anterior half of this cortex. It innervates this area both both his frontal, this one at the parietal, and half of this parietal part, this area at the superomedial surface. So medial part of this orbital surface, medial superolateral surface 1 to 2 cm innervated by the anterior cerebral artery, and this part it's innervate the middle cerebral artery, and this area is supplied by this posterior cerebral artery. Now, occlusion of this anterior cerebral artery, it may lead to this motor and sensory loss of the opposite side of this leg and foot. Loss of the sensation of lower limb and the urinary incontinence, because at the motor cortex innervate from the above downward, hip, foot, hip, trunk, arm, head, face, tongue and larynx, and loss of the sensation of this lower limb and the urinary incontinence, and gradual changes in personality orbital cortex. So this one are the symptom develop if there is an anterior cerebral artery. So anterior cerebral artery further it divide into this anterior medial and anterolateral branch of this central artery. So this one are the anterior medial central branch of this anterior cerebral. Now middle cerebral artery, it is branch of this internal carotid artery and supply the medial half at the stem of this lateral surface, and it divide into this middle cerebral into the superomedial surface. This area it's supplied by the middle cerebral artery. In superolateral surface, this whole part is supplied by the middle cerebral artery. So any functional area supplied by the middle cerebral artery. Here there is a lower part of this primary motor area, area 4, premotor area, area 6, somatosensory area, area 3 and 12, 3, 1 and 2, parietal lobe, prefrontal area, area 9, 10, 11 and 12, frontal lobe, and Broca's motor speech area 45 and 44. So frontal lobe in the left hemisphere, auditory area 41 and 42, temporal lobe, and supramarginal gyrus 40, inferior parietal lobe. So angular gyrus 39 and superior temporal gyrus 22 or the 1x area. So this one are the supply by the middle cerebral artery. Now any occlusion of this middle cerebral artery, there may be motor and sensory loss of opposite side of the body above the trunk, and spastic paralysis of the trunk in upper motor lesion in the lower part of this face. So global aphasia or the Broca's in the 1x area. This one are this central branch of this anterolateral branch of the middle cerebral artery. Now circuits of Willis on its branches provide a number of central branch which penetrate the base of brain and supply the diencephalon, corpus striatum and the internal capsule. The branches are as follow: anteromedial branch, parieto-anterior lateral branch, posterior-medial branch and parietate posterior-lateral branch. The central branch of the anterior arterial supply of the cerebrum. So this branch and its distribution into the anteromedial, anterolateral, posterior-medial and posterior-lateral. Anteromedial, anterior part of this hypothalamus, head of this caudate nucleus, internal capsule. Artery of the thrombosis. Anterolateral, internal capsule, lentiform nucleus, artery of the cerebral hemorrhage. Posterior-medial thalamus, subthalamus and mammillary body. And posterior-lateral geniculate body and the cerebral peduncle. These one are the branches and distribution of the central artery. Now internal capsule is divided into this anterior limb, genu and posterior limb. So anterior limb it's supplied by this striated branch of the middle cerebral artery, recurrent branch of the anterior cerebral artery. And genu is supplied by this striated branch of this middle cerebral artery and branches from this internal carotid and posterior communicating artery. And posterior limb it's supplied by this anterior half by the striated branch of this middle cerebral artery and posterior half supplied by this anterior choroidal artery. And retrolentiform part of the posterior limb is supplied by this branches of this anterior choroidal artery. So this one are the blood supply of this internal. So it is very important of the blood supply. If you have a knowledge about the blood supply, then and there you can easily rule out the patient of the stroke. So vein of the brain, no muscular tissue, no valve lie in subarachnoid space, pierce the arachnoid and the dura. Dura matter drain into the venous side. Divide into this external vein, superior cerebral vein, middle cerebral vein. So further divide into the superficial and deep part. And inferior cerebral vein are the transverse sinus. Drain into the transverse sinus. External vein at the basal vein, middle deep cerebral vein, plus striated vein, and anterior cerebral vein. So drain into this great cerebral vein. So this one are the venous of this brain. In a great cerebral vein plus inferior cerebral sinus drain into the straight sinus. So you can see this confluent of this sinus, this one is the transverse sinus, this one is the straight sinus, ultimately drain into the segment sinus, then they communicate into the internal jugular vein. So another major extracerebral vein and internal cerebral vein. So finally into the internal jugular. Now rigidity and the type of this increase the resistance to passive limb movement, either cleft knife spasticity or the lead pipe rigidity or cogwheel rigidity. So this one are the rigidity with the superimposed in tremor. So cleft knife rigidity, here there is a corticospinal tract is lesion, increase then decrease in resistance tone as stretch. Lead pipe rigidity, here you can see this lead pipe rigidity, there is a basal ganglia lesion, continuous resistive tone and throughout the stretch. And cogwheel rigidity, here there is a PD and the related disorder. So this rigidity with superimposed tremor. So this one are the basal ganglia lesion, corticospinal tract and the PD and the related disorder. So this depend upon the rigidity. Here you can see this video on the cleft knife rigidity. Here there is a rigidity occur by the patient when there is a flexion of this elbow. So this type of this rigidity name is given the cleft knife rigidity. Now second one, cogwheel rigidity. Here you can see this flexion, there is a cogwheel rigidity is developed. So this one are the occur if there is a upper motor neuron lesion and the lower motor neuron lesion. So what is the stroke? Write down the question in early clinical exposure. First question, what is the stroke? what is the blood supply of spinal cord, what is the blood supply of internal capsule, and what is Weber syndrome, what is the basic mechanism controlling the muscle tone, and what is the positional imaging tomography or the PET. So this one are the question is related to the early neurological disorder and why you should know about the blood supply of brain. So here there is a complete the topic of this early clinical exposure of neurological disorder. So first question should be write down in your logbook, what is the stroke, what is the blood supply of spinal cord, what is the blood supply of internal capsule, what is Weber syndrome, what is the basic mechanism controlling the muscle tone, and what is the positional emission tomography, and why you should know about the blood supply of brain. So here there is a complete the class of this neurological disorder. So thank you for watching and stay safe.